Hello everyone, welcome back to my channel, that is Obstetrics and Gynaecology Simplified. Today we will be discussing about a very important topic, that is the placenta. Okay, the placenta, it is a feto-maternal organ. It is frequently asked in the exams, and also the short question or long question can be asked from the topic placenta and its anomalies and also the abnormalities of the cord. Okay, so let's start with placenta. So what is placenta? It is a discoid, hemochorial and deciduate type. What is discoid? Discoid means we are talking about the shape of the placenta. Okay, so the shape of the placenta, it is discoid or disc shape, and it is hemochorial, means we have the maternal blood flowing through the placenta. And what about the deciduate? Deciduate means it sheds. Okay, it sheds after delivery of the fetus or the baby. Okay, then coming to the development, we will be discussing about the development also and also the functions of the placenta. Okay, so what is the development? See, placenta, it is developed from both fetal surface as well as the maternal surface. See, placenta, it is a discoid shape, it is hemochorial and it is deciduate, we know, but it has two surfaces. Okay, the fetal surface and the maternal surface. The maternal surface, it is attached to the uterus, and the fetal surface through the umbilical cord, it is attached to the fetus. Okay, so it has two surface. One is fetal surface and another is maternal surface. I'll show you that pictures I took during the delivery. Okay, so fetal surface and maternal surface. Fetal surface, how do we characterize the fetal surface? It is smooth, it is shiny, and it is covered by the amnion. You remember, it is covered by the amnion, whereas the maternal surface, it is not covered by the amnion, so it is not shiny or not grey in color, and it is abrupt or it is rough and dull, and it is not shiny because the amnion is absent in the maternal surface and it is only covered in the fetal surface. Okay, so it is smooth, shiny because of the amnion, and the umbilical cord, it is attached near the center. Okay, and the chorionic vessels radiate from the cord insertion. This is the fetal surface. What about the maternal surface? See, the maternal surface, I have told you, as there is no amnion. Okay, no amnion, so it is rough and dull, and it is divided into cotyledons. Okay, 15 to 20 cotyledons average, and each cotyledon, it is supplied by the spiral artery. Okay, so the placenta consists of the cotyledons. See, I'll show you the diagram. I'll show you. You can just see. See, this one is the, see, two surfaces I'll be showing. See, this one is one surface and this is another surface. So what is this surface? See, this is the rough and dull surface and this is the cotyledons. Okay, this is the cotyledons. So this is the maternal surface. This is the maternal surface. Okay, then what about the fetal surface? See, this is the shiny one. This one is the amnion. Okay, this is the amnion. So it is the this is the shiny amnion, and this is the umbilical cord. Okay, this is the cord, and these are the branching vessels. Okay, so this is the fetal surface. So there is two surface, that one is fetal surface and one is maternal surface. The fetal surface, it is shiny and it is covered by the amnion and it is grey in color, whereas the maternal surface, it is rough and cotyledons are present and this is dull in color. Okay, then coming to the fetal surface and placental surface, I'll write something, just follow this. See, fetal surface and maternal surface, or fetal part and maternal part. Fetal part and maternal part. It is formed by chorion, frondosome and cytotrophoblast, but maternal part it is formed by decidua bacillus. Got it? Then write some features about placenta. Placenta, it is formation begins by 6 weeks. Okay, and anatomically ends by 16 weeks, but physiologically it continues till term. Physiologically continue till term. Okay, then weight at term, it is 500 grams. Okay, then ratio of the placenta, what is the ratio of placental weight is to fetus at term? It is 1:6. Okay, 1:6. And weight of, when is the weight same? Weight of placenta is equal to the weight of fetus. It is at 17 weeks of pregnancy around. Okay, around 17 weeks of pregnancy. These are the questions. Okay, all these are questions. Okay, these are one liners, these are questions. Okay, then coming to the, I've told you, see, I've told you about the features. I've told you here. See, features what? First, it is discoid, means disc shape. Hemochorial means it is attached to the, in contact with the maternal blood. It is in contact with maternal blood. And it is deciduate, means it sheds after delivery of the baby. Then what is the diameter of the placenta? See, this is another image. Just see, this is the placenta. This was a twin pregnancy. Okay, this was a twin pregnancy. Then the first twin was see, this is the remnant of the first twin. Okay, the first twin, when the ultrasound was done, then both the babies were present, because it was an IVF pregnancy. So 3 embryo transfer was done, and out of 3, the 2 were present and 1 was reduced. Okay, selective reduction was done, and then 2 babies were alive. But then during term, gradually the second twin also disappeared. Okay, see, this one is the remnant of the second twin. So only the first baby, only one alive baby was delivered, and this one is the remnant of the second twin. Okay, so this was a twin pregnancy, IVF pregnancy, and cesarean section was performed because of oligo. Okay, then coming to the next, coming to the diameter of the placenta. Diameter of placenta, it is 15 to 20 or 22 centimeter. Okay, then thickness up to 4 centimeter is normal, and if more than 4 centimeter, that is placentomagaly thickness. Okay, this is the thickness. If more than 4 centimeter is the thickness, then that is placentomegaly. And what are the causes of the placentomegaly? See, causes of placentomegaly. First, fetal anemia. Fetal anemia can occur in Rh negative pregnancy. Okay, in Rh negative isoimmunized pregnancy, fetal anemia can occur, and also in hydrops fetalis also the placenta is swollen and there is placentamegaly. And in maternal diabetes, molar pregnancies, as well as the tumor of the placenta, that is chorangioma, and intrauterine infections. If anyone asks you what is the most common infection that leads to placentamegaly, you will answer it syphilis, then cytomegalovirus. Okay, so syphilis most commonly causes placentamegaly. Okay, then we will discuss about, see this one we have discussed about the causes of placentamegaly. Then what are the causes of small placenta? Then causes of small placenta, see causes of small placenta, first it is uteroplacental insufficiency, like in PIH and IUGR. Okay, high blood pressure, IUGR. Okay, independently also IUGR may cause maybe the cause of small placenta or uteroplacental insufficiency. Okay, both are interlinked. Okay, and also small placenta may be because of constitutionally small baby. Small placenta. Okay, see, let me draw you a diagram showing. See, let this one is the uterus. Okay, if this is the uterus, let the placenta is attached here. I will show you. See, let the placenta is attached here. Okay, so when the placenta is attached here, this is attached here. Okay, so this one is the maternal side, and this one is the fetal side, where umbilical cord is attached, and this is the baby is present. Okay, so this is the fetal side or fetal surface. Okay, understood? See, this one is the maternal part and this is the fetal part. Okay, so this is how the placenta is attached to the surface or the endometrium. Okay, so we will understand now about the formation of the placenta, how the placenta is formed. I've told you both surface. See, the fetal surface is formed from chorion frondosum and the maternal side is formed by the decidua basilis. Okay, I've told you. So how it is formed? See, formation first from the chorionic plate, fetal side from the chorionic plate and maternal side from the basal plate. Fetal side and maternal side. Fetal side from the chorionic plate, and maternal side from the basal plate. See, I will show you the diagram here. Just see. This is the fetal surface, umbilical, where the umbilical cord is attached. See, this one is the umbilical cord. It is attached in the fetal surface, and this is the maternal surface where it is attached to the uterus, okay, or the endometrium. This is the maternal spiral artery, okay. And this is the intervillar space, and this is the maternal veins, arteries and veins, and this is the umbilical cord, and here the placental barrier it is present, and this is the fetal arteries, okay. So this is the umbilical veins and arteries, okay. And this is the fetal surface, and that is the maternal surface, okay. I'll just zoom out and you can just see, okay, this is the fetal surface and this is the maternal surface, okay. These are the arteries, and these are the villi, okay. So how it is formed? See how it is formed, I will tell you, from the fetal side and the maternal side, okay. So it develops from, I told you, chorion, frondosome, and here it develops from deciduum basilis, okay. And develops, see this one, it forms 4/5, the fetal surface, it forms a 4/5 of placenta, whereas the maternal side it forms 1/5, okay. Here it is shiny grey, I've told you, and cord is attached, whereas here dull red or maroon polygonal lobes are present, that is called as cotyledons, and lobes are divided into lobules, okay. That is the functional unit of placenta, okay. Understood? And then what are the steps of placental formation? We know that when the zygote it divides after multiple division, it forms the morula, okay. First it forms the blastomere, then it forms the morula, and then fluid is when the fluid is filled within the cavity, then it forms the blastocyst, and the blastocyst gets implanted in the uterine cavity, and then it develops into inner cell mass and trophoblast. So that trophoblast it differentiates into cytotrophoblast and syncytiotrophoblast, okay. That cytotrophoblast and syncytiotrophoblast, when they are invaded by the extraembryonic mesoderm, then that forms the secondary villi, okay. The primary villi it is formed by the extension of the cytotrophoblast and syncytiotrophoblast, and then when the extraembryonic mesoderm is invaded, and then it forms the secondary villi, and then when the capillaries are invaded into that, the fetal capillaries are invaded into that, that is called as the tertiary villi, and then the syncytiotrophoblast forms the lacuna, where in the lacuna the maternal blood it is present in the lacuna, and so the fetal capillaries through the fetal capillaries the blood is transferred from the deoxygenated blood, it diffuses from the capillaries and then to the cytotrophoblast, then into the syncytiotrophoblast, then into the lacuna, and then into the maternal blood vessel. Similarly, the oxygenated blood it is also diffused back, okay. Then so how it is formed? See, I've told you that what are the steps then? See, steps of placental formation. First, starting from the inner cell mass and the trophoblast. So trophoblast is differentiated, okay. Trophoblast it differentiates into cytotrophoblast and syncytiotrophoblast. Okay, cytotrophoblast and syncytiotrophoblast. Cytotrophoblast, it is the inner and cellular part, and syncytiotrophoblast, it is the outer and invasive part. Okay, then it erodes the syncytiotrophoblast. What it does, it erodes the maternal capillaries and forms the lacuna. Okay, it erodes maternal capillaries and forms lacuna. Okay, so lacuna formation, it is there. Then in the lacuna, the maternal blood is accumulated. Okay, so in the lacuna, the maternal blood is accumulated. And then what? How the villi is formed? See, how the chorionic villi is formed? Chorionic villi formation. See, first, primary villi. I've told you, see, I just will draw a diagram for you all so that you can just understand a better way. See, let this one is the cytotrophoblast. Okay, I told you it will invaginate. Okay, so this is the cellular layer and the cytotrophoblast layer. Okay, so this is the cellular cytotrophoblast part. Okay, and this is the acellular syncytiotrophoblast part. This is the fetal surface and this is the maternal surface. Okay, chorionic plate and the basal plate. This is the basal plate and this is the chorionic plate. And here what happens, this is the primary villi. Okay, so this one is the primary villi. This is the primary villi. Then what happens when the, see, what happens when the extraembryonic mesoderm, it is invaded into the cytotrophoblast layer, that is called as the secondary villi. So what is secondary villi? In secondary villi, the extraembryonic mesoderm, that enters the primary villi. And then there forms, see, this one is around day 12, this one is around day 16, then there forms tertiary villi. When tertiary villi is formed, what is tertiary villi? In tertiary villi, what happens? This is around day 17. What happens? The utero-placental circulation is established. How? See, here what happens? The fetal blood vessels, it is invaginated into the extraembryonic mesoderm and the circulation. See, here the maternal blood is present. Okay, here the maternal blood is present. This is the lacuna. Okay, the maternal blood is present and the deoxygenated things from here are diffused into the maternal blood. Okay, understood? From the fetal capillaries. This is the fetal capillaries. Okay, this is the fetal capillaries. Okay, so this is the fetal capillaries and this is the formation of the tertiary villi. This is where the uteroplacental circulation is established. Okay, so what is the placental barrier? It consists of what? See, placental barrier consists of syncytial trophoblast, I've told you, cytotrophoblast, the basement membrane, okay, and then villus stroma and endothelium of the fetal capillaries. This is the image of the placental barrier. Okay, this is the placental barrier. That is the fetal blood and the barrier between the fetal blood and the maternal blood. Okay, here is the fetal blood, here is the maternal blood. So the barrier, syncytial trophoblast, cytotrophoblast. See, this is the fetal capillaries and this is the basement membrane. So all these are the barrier of the, this is called as the placental barrier. Okay, understood? Then chorion, see how the chorion frondosome is formed. Formation of the chorion frondosome. Villi at embryonic pole. What it does, it proliferates to form the chorion frondosome. Okay, then what about the other end? Villi at embryonic pole or the opposite pole. Okay, that is called as the abembryonic pole, that is regresses, and it is called as chorion leaf. Okay, so this is the, it proliferates embryonic pole, the villi proliferates, it is called as chorion frondosome, and the other part, okay, at the abembryonic pole, it regresses, the villi regresses, and it is called as the chorion leaf. So placental barrier I've told you. Then about the placental circulation. See, the placental circulation, it has villi, placenta has villi and intervillar space. It has villi and intervillar space, and villi carries fetal blood. I've told you, no, the fetal capillaries are present. See, this is the fetal capillaries. Okay, this is the fetal capillaries, and it carries the fetal blood. It is present in the primary villi. So villi carries fetal blood. Okay, understood? So villi carries the fetal blood. And what is the volume? It is 350 ml. Okay, then there are two types of circulation. See, there are two types of circulation. One is uteroplacental circulation, and the other is fetoplacental circulation. Okay, so uteroplacental circulation, it is the maternal blood. Okay, so from the uterus, what will come? The maternal blood through the intervillar space. I've told you that is the lacuna, intervillar space. Okay, that is the uteroplacental circulation. Okay, that is the maternal blood. And what about the fetoplacental circulation? It is via the umbilical veins and arteries. How? See, this is the fetus and this is the placenta. The oxygenated blood, it goes to the fetus, and through the fetus it comes back to the placenta. What? Deoxygenated blood. This is the fetoplacental circulation. This one I will just explain you. Complete video will be out. The fetus and fetoplacental circulation, or the fetal circulation in simple words. I will be making a simplified with a diagram. A video will be coming very soon. Okay, so just remember here, there are two types of circulation. One is uteroplacental circulation, another one is the fetoplacental circulation, and it is the circulation of the blood from the fetus to the placenta and then from the placenta to the fetus. Okay, so this is the fetoplacental circulation. Then it is established at day 15 after of fertilization. Okay, and at term it is 500 to 750 ml per minute. The maternal blood flow to the placenta, it is 500 to 750 ml per minute. See how much much volume of blood it is flowing, because the fetus needs blood at term. So at term it is 500 to 750 ml per minute. Okay, around 1 liter. It is not, means half to 7.5. Okay, 750 ml per minute it is flowing. Okay, because at that time it is necessary. Okay, the blood flow is necessary, it is required for the fetus at term. Okay, and the number of spiral arterioles is 100 to 200. Okay, got it? And then here it is 400 ml per minute. That is the fetal blood flow through the placenta. Okay, it is 400 ml per minute. This is 500 to 750 ml per minute. Okay, but this is the flow rate. Okay, this is 400 ml per minute, but the volume of fetal blood that is present, I've told you what is the volume, that is 350 ml. That is different. Okay, flow rate is different, that is ml per minute, but the flow volume, not flow volume, only the volume. Okay, the volume is 350 ml. The fetal blood, it is present in the placenta, that is 350 ml. Okay, then what about the functions of the placenta? See, respiratory functions, nutritive functions, excretory functions, endocrine, immunological, and metabolic. Okay, the respiratory functions, due to exchange of the gases. Nutritive functions, all the nutritions, amino acids, vitamins, minerals, all are transferred through the placenta from the mother to the baby. Okay, and excretory functions, all the amino acids, ammonia, uric acid, these are excreted from the fetus through the placenta. And what about the endocrine function? See, various hormones like HPL, okay, human placental lactogen, beta HCG, okay, these are secreted. Cortisol, these all are secreted from the placenta. Cortisol helps in delivery. Okay, then what about the immunological? See, the IgG immunoglobulins, these are passed through the placenta to the baby, so it helps in immunity and also the metabolic functions. So these all are the functions of the placenta. In the next video, we will be discussing about the anomalies of the placenta and the umbilical cord. Okay, till then keep learning, and any doubt you are very much free. We can just discuss and just get involved and keep learning and keep studying. Okay, thank you.